reversing high blood pressure naturally. Reversing high blood pressure naturally. So we want to look at doing that. When we look at high blood pressure, to understand high blood pressure, we need to understand a few things about our cardiovascular system. First of all, our cardiovascular system is a hydraulic system. Hydraulic meaning that it's a fluid-filled system. It has a pump, that's your heart, right? It has pipes, those are your blood vessels. It has valves, right? And you have valves. And it's all there to move fluid, which is the blood, under pressure throughout that system so that you can get it to move around, move around, move around. All right? So that's the hydraulic system. And the components of this hydraulic system are primarily controlled by the nervous system. Again, we've talked about that before. Pretty much everything is under control of the nervous system. And the nervous system can monitor how much volume you have in the blood. It can monitor how much pressure is going on inside the blood vessels. It can monitor changes to blood pressure and send signals back up to the brain and then back down to the heart and the blood vessels in order to compensate for those changes. If you didn't compensate for those changes, then every time you tried to sit up in bed, you'd pass out. Sometimes I wish that was the case. I'd have an excuse not to go to work. But no, I mean, you would cease having blood flow going to your brain because you wouldn't be able to respond to the change in blood pressure. And you wouldn't be able to stand up. And so it's good to be able to respond to these different things. But there are a number of things that can mess up this system so that it doesn't function the way that it's supposed to. Factors that are known to contribute to high blood pressure are age. All right? So individuals who age tend to have higher blood pressure. But. Yeah, this is a good but. But there are studies of certain populations that have very low salt intake throughout their lifetime. And those populations which have very low salt intake throughout their lifetime, their blood pressures do not go up over time. In other words, as they age, their blood pressure doesn't go up. And in fact, in one of those populations, the blood pressures of the 70-year-olds are about 3 to 5 millimeters of mercury less than teenagers in the population. Right? So with blood pressure going up with age, may not have to do just with age. It may have to do with prolonged exposure to other factors that cause blood pressure to elevate. And the longer you're exposed to it, the more you're going to manifest the effect of that exposure. Another factor we know that is alcohol. Increased alcohol intake over time increases blood pressure and death from cardiovascular disease. Don't get the, well, I suppose we can jump on that bandwagon right now, or off the bandwagon, or kick the bandwagon, or whatever. Media likes to jump on certain things, and most of the media personnel like to drink, and so they like the studies that show that wine intake and so on and so forth, alcohol intake, improves cardiovascular disease. Well, we know from medical school that alcohol is cardiotoxic. Right? Alcohol damages the heart. So how is it that you can have studies that show that wine intake and so on and so forth helps to improve cardiovascular disease? Well, it's not the alcohol. It's the resveratrol and the other phytonutrients that are in the grape and the skin of the grape that actually is cardioprotective. And so you have the alcohol, but then you have the good stuff that's along with it. And the overall effect from a cardiovascular standpoint is that it improves cardiovascular health by having up to 2 glasses of wine a day. But guess what? Those same 2 glasses of wine a day that improved your cardiovascular disease rates are the very ones that double or more than double your risk for breast cancer. and cause so many other different problems across the world, social issues and car accidents and deaths and rapes and unexpected babies and other types of stuff like that, because alcohol affects the frontal lobes and your ability to reason and think and perceive and so on and so forth. All right, another cause for high blood pressure is chronic kidney disease. And so chronic kidney disease, the kidneys are intimately involved in this process of blood pressure regulation, blood pressure management. And if you have too much fluid in the blood vessels, then they're going to have extra pressure. And if the kidneys aren't working the way that they're supposed to, then you'll have the accumulation of increased fluid over time, and blood pressure increases. Plus, the kidneys are hormone producers, and some of the hormones that the kidneys produce help to monitor or alleviate the blood pressure. And if they're not working, they can't release those hormones, and they can't cause the blood pressure to come down. And so you can have high blood pressure because of chronic kidney disease, and you can have chronic kidney disease because of high blood pressure. Another cause for high blood pressure is illegal drugs. Things like cocaine and amphetamines. They increase the blood pressure. They can cause heart attacks and death from its use. It's always fun getting those in the ER, but I've had a number of those that have come in with heart attacks because of cocaine use. Yeah, I won't tell stories. All right. There are many more legal drugs that increase your blood pressure than the illegal ones. You might not have known, but Tylenol. Tylenol is known to increase blood pressure. All of your NSAIDs, your non-steroidal anti-inflammatory drugs like Motrin and Aleve and so on, those increase blood pressure. Your cough and cold medications, your nasal decongestants, all of those increase blood pressure. And sometimes you get warnings that say that if you have high blood pressure, if you're on blood pressure medication, don't take these or talk to your doctor first. Birth control pills and other estrogens, those increase blood pressure. Testosterone replacement therapy increases blood pressure. Antidepressants, steroid medications, corticosteroids, certain cancer medications, angiogenesis inhibitors that seek to decrease the amount of blood vessel growth to the tumors, those can cause it. Immunosuppressants, migraine medication, performance-enhancing drugs, and caffeine. All of those are things that are known to increase high blood pressure. And so if you're on those and you have high blood pressure, well, you might have to ask yourself whether you need to be on them or not, right? There are genetic factors that can be associated with high blood pressure as well. Mutations that block normal pathways of salt regulation and hormone secretions involved in blood pressure maintenance. Those can cause high blood pressure. If you have problems with the thyroid, specifically high or overactive thyroid, hyperthyroidism, that can lead to high blood pressure as well, sometimes dangerously high blood pressure. And overweight and obesity. All right, that's a big cause for high blood pressure. What happens there? Well, your fat tissue, as we mentioned in the last lecture with diabetes, the fat tissue is enzymatically active. It's hormonally active. It produces hormones. And one of the hormones that the fat produces is called leptin. And leptin is a hormone that has several functions. One, it causes you to feel full earlier. Two, it causes your metabolic rate to increase. And number three, it stimulates an area of your brain called the hypothalamus. The hypothalamus is in charge of your fight or flight response, your sympathetic nervous system, and it stimulates your sympathetic nervous system, your fight or flight response. And with that sympathetic nervous system, your blood pressure goes up, causes the blood vessels to constrict. When they constrict around the blood pressure goes up, right? All of that's a response associated with it. Well, unfortunately, over time, the leptin, its effect on appetite goes away, and its effect on metabolism goes away, but its effect on blood pressure doesn't go away. So you're just left with the blood pressure effect over time. And the more fat cells you have, the more leptin is produced. And so as you lose that fat, then the leptin levels go down and it helps. We also know physical inactivity is another factor associated with high blood pressure, not just because of obesity, but because you don't have exercise. And exercise helps to decrease blood pressure. All right, salt. Salt is another major factor as well. It's definitely true that it's a problem. Again, we mentioned about the population studies associated with salt. There are some studies that have been out maybe for the last 10 to 15 years identifying the metabolic pathways where salt affects. We're still not really sure exactly all of it, but there's orexin and some other hormones that are involved in blood pressure management that it seems like salt affects those hormones, which then affect the blood pressure over time. Smoking. Smoking is another factor, a contributor to high blood pressure. Nicotine is a stimulant. It increases the force of the heart beating, so the pump pumps harder. So that means the blood pressure is going to be harder, and it causes those blood vessels to constrict as well. So that's going to increase your blood pressure. Sleep apnea, that's a condition where you stop breathing while you're at night. If we had time, we could demonstrate it for you a little bit. But anyways, individuals snore, and they have some pretty loud snoring, and then they stop breathing for a while. And then they eventually, then they get back to their normal breathing pattern, and then they snore for a while, and then they stop breathing. And sometimes that stopping breathing can be for a long time. And then they repeat that over and over throughout the night. Well, you can imagine if somebody suffocated you over and over and over and over and over and over, how stressed would you be? And if you're all stressed like that, what would your blood pressure be like? Well, that's what happens. And then you wake up and you wonder why you weren't rested. Why, I got 10 hours of sleep last night and I still feel like I haven't slept a wink. Well, it might be because you're not breathing at night and you've got sleep apnea. And also stress, of course. Psychosocial stress is a major contributing factor to high blood pressure. There are some individuals, we'll work with them and we'll do all the lifestyle stuff and the herbs and the treatments and everything. We just cannot get their blood pressure down. But they've got something on their mind. And if we can identify what it is and help them resolve it, see that blood pressure coming right back down. It's amazing. So, blood pressure, what about it? Well, it has two numbers. You have a top number, which is called the systolic number. That represents the force inside the blood vessels when the heart pumps, the maximum force that you get. And then you have the lower number, the diastolic, and that represents the force that's still left in the blood vessels when the heart is resting. Right? So it never goes down to zero until you're dead, but not just when you're dead, for a few hours after you're dead. Either that or you leak out. If you run out of fluid, then you go down to zero, but it doesn't usually go down to zero. So your normal should be at less than 120 over 80. So if you're in the teens and you're over the 70s, then you should be okay, although there's some studies that say not 120 over 80, it actually should be 115 over 75 or lower as far as the normal range. Well, prehypertension officially is 120 to 139 over 80 to 89. Your hypertension stage 1 is 140 to 159 over 90 to 99, and stage 2 is greater than 100 or 160 or greater over 100 or greater. All right, and that gives you just the idea of the different stages. And let's say, for instance, you have a blood pressure of 138 over 90. Where are you at in here? Are you prehypertension or are you hypertension stage 1? Stage 1. You'd be stage 1, that's right. You'd be stage 1 because it's whatever, if one of the numbers is in a higher category and the other one's in a lower category, you are the higher category, whatever it might be, right? So you'd be stage 1. But high blood pressure should not be diagnosed until you check the blood pressure at least twice on 3 separate occasions. And it's consistently high. That's part of the diagnostic criteria with it. All right. So what should you expect as far as symptoms associated with high blood pressure? All right. They call it the silent killer. Why do they call it the silent killer? Because many times you don't have any symptoms associated with it. Now, some people do. You know, they feel this pain in the back of their neck, or they get a headache, or they're starting to get a little dizzy, or they get some blurry vision or whatever. If you do, praise the Lord. You're blessed. There's other people, they don't have any symptoms, and the majority of individuals with high blood pressure actually don't have any symptoms of high blood pressure. And so you don't know that you have it until something goes boom, and you go boom. Right? For the research estimates that somewhere around 40% of individuals, the first symptom that you have of heart disease is dying from your heart attack. That's not good. You didn't know it was a problem, and now you're dying, and then you're gone. Right? So you want to check it out. How do you know if you have high blood pressure? Measure your blood pressure. Now, if anybody wants your blood pressure measured before you go, we can do it. We got the stuff in the back. We can check it. All right, so check your blood pressure to see where you're at and if you're doing okay or not. What does it do? Well, it damages everything if the blood pressure is high. You've got blood vessels going everywhere. It can damage the blood vessels going everywhere. And if it's to the brain, then you can have strokes, or you can have encephalopathy, which is confusion and headache, and maybe convulsions and that kind of stuff as well. You can have damage to the eyes, leading to vision problems and blindness. It can affect the heart, so heart attacks and heart failure. Kidneys can have damage, and it's the second leading cause of kidney failure. And there's so many other things that's going along associated with it. So none of us want the complications of high blood pressure. So what do we do about it? Pop a pill. Oh, okay. No. Well, we can take a look at some of the steps that you can use at home, in the safety of your own home and the comfort there, in order to help with reversing that high blood pressure using some natural things. Step number 1, sounds like diabetes, fast. That's right, fast. Drinking only water, or water in the herbal teas that we're going to talk about later. And in our 47 years of existence at UG Pines, we have found that blood pressure decreases quite quickly when somebody is fasting, typically. Right? Typically decreases. Gerry came to us, and I don't have Gerry's picture, but I just grabbed a Gerry off the internet. So if you know who this guy is, I'm sorry. So Gerry came to us, and he was having problems with high blood pressure. And he had tried most everything. He was a physical therapist, and he was doing lots of exercise and trying to get his blood pressure down that way. He was kind of watching what he was eating and keeping his salt levels down. And blood pressure was still 180s, 200, 220, and he was having difficulty, and he didn't want to take the medication and so on. And so he eventually came to UCHI. And he came and he saw us, and his blood pressure wasn't doing so bad at that time. It was only in the 180s. That's bad. But it was in the 180s, so at least it wasn't in the 200s. And so we started him on a fast. And so he was on a fast one day, and his blood pressure came down to the 170s. And he was on fast for 2 days, and his blood pressure came to the low 170s. And he was on the fast for 3 days, and it was in the 160s. And he talked to me and he said, "Hey, Doc, can I just continue fasting?" And I said, "Sure, that's fine. We were just planning on 3 days, but sure, you can go ahead and continue." And so he continued, and the next day it was the 150s, and the next day it was the 140s, and the next day it was 130s, and we eventually landed in the 120s. Right? Just after about a week or so of fasting, his blood pressure was down in the 120s, where he started in the 180s. And it was just remarkable. Every day was like a stair step of his blood pressure decreasing, decreasing, decreasing. Now, not everybody does that. His was an interesting thing. But we do fairly consistently see that blood pressure decreases when an individual fasts, or while they are fasting. Right? And then after he started eating, he fluctuated between the 120s and the 140s. But he was never up again, back up in the 160s, 80s, and higher. So that was great. So step 1, fast. Step 2, eat a low sodium diet, right? Avoid all of those salty foods. What does low sodium mean? It means that you eat less than 1,500 milligrams of salt a day. What does that mean? That means that you eat less than about 3/4 of a teaspoon for the entire day in all of the foods that you eat. Now, where are you going to get most of your salt? Most of your salt in the American diet comes from cheese, comes from soups, comes from breads, and meat. Right? That's where you're going to get most of your salt in the American diet. It comes from cheese, from soups, from breads, from meat. Right? And then it comes from the crinkly things, right? The crinkly bags. They usually have high salt, and you have to watch out for restaurants. Right? A few studies that have been done looking at foods, same foods prepared at home and foods prepared in the restaurant, and in the restaurant it has at least twice as much salt in it as you would prepare it at home. Right? It needs to be tasty to get you to come back and pay the money to go. Right? So watch out for those things. That's where you're going to find high sodium. Reggie, he came to us a few years ago. He had high blood pressure and kidney failure. It was kind of early stages of kidney failure, and he was with us, and he was applying all of the healthy lifestyle factors that we've been talking about. And his blood pressure didn't change much. It was still bad. And his kidney function actually got worse while he was at UT Pines. Go figure. So, well, we encouraged him to continue on his healthy lifestyle, saying that healthy is healthy, right? So go ahead and be healthy, and we'll see what healthy does over time. Well, it wasn't until about 6 months later, as he continued doing the healthy things, that his creatinine levels associated with the kidney function started coming really back down and getting into a good range. And he was able to get it down into a good range, and it took him probably 8 or 9 months before his blood pressure really started improving and getting better. Right? But it did. But it took time, and he had to be consistent with it. Number 3, you want to maintain a high potassium to sodium ratio. Potassium has kind of an opposite effect when it comes to blood pressure as the sodium does. And so if you eat foods that are high in potassium, low in sodium, that is helpful. What kinds of foods are those? Well, nuts and seeds have a high potassium to sodium ratio. Legumes do as well. Soy performs the best out of them all as far as a potassium to sodium ratio. We've got dried fruits that are fairly high, whole grains, regular fruits, mushrooms, lamb's quarters, which is those greens in the middle there. That's lamb's quarters. And then things like squashes and potatoes. They seem to be fairly good when it comes to potassium to sodium ratio. So all of those are good from that standpoint. Now if you eat meat, it's the opposite, right? Because it tends to have quite a bit of sodium. That's the greatest intracellular electrolyte, and so it tends to be quite high in sodium, quite low in potassium. Like you and I, our blood levels of sodium are 135 to 145, but our levels of potassium are only 3.5 to 5.5. So, and we're like a lot of the other animals, high sodium, low potassium. So if you eat the opposite, it does better. Step 4, include blood pressure reducing foods in your diet. Research shows that eating barley, again we saw barley with cholesterol. No, with diabetes, that's right. We saw barley with diabetes, diabetes reduction. Well, it also helps with high blood pressure. No, it was oats that was with diabetes and cholesterol. We saw barley with cholesterol, but barley is also beneficial with high blood pressure. Blonde psyllium as well, which was helpful with cholesterol, is also helpful with blood pressure. Celery is another one that is beneficial. How much celery? Well, you're looking at about 3 stalks or so of the celery a day. The barley, you're looking at about a bowl of cooked barley for the day. Blonde psyllium, how much? About 3.5 grams, 3 times a day. That's what one of the studies showed. They were using about 3.5 grams of it 3 times a day. Flax, how much? 2 tablespoons a day. Again, as I mentioned yesterday, flax is the single food item that has the greatest blood pressure reduction in a research study that we know of from just a food item. And it should be freshly ground before you eat it. That way, if you eat it in the seed form, most of it just goes on through in the seed form. And it doesn't get digested, just like when you don't eat your corn very well. You find it again. All right. So it should be freshly ground, 2 tablespoons a day. Garlic, looking at about 5 to 10 cloves of steamed garlic on a daily basis. That helps to reduce blood pressure. Olives. All right, so olives, just adding olives liberally. Olives can be mixed with anything. Huh?
They're salty.
Yeah, but you gotta, yeah, it's true. But
Dip them in apple cider vinegar.
wash them in water. That'll help to decrease the salt content. And so you swish them around in water, the salt will, again, salt goes from a high concentration to low concentration. So you put it in water, that's especially distilled water, and you'll pull quite a bit of that out of it. But yes, the research shows that eating olives actually decreases blood pressure. Wheat bran is also beneficial, and you're looking at about 3 to 6 grams of wheat bran daily in some of the studies. There are also, step 5, blood pressure reducing supplements. And there's a few like coenzyme Q10, folic acid, which is vitamin B9, guar gum, and L-arginine. Those are some of the supplements that have been shown in research to help decrease blood pressure levels. Some more effective than others. We usually use L-arginine quite frequently, CoQ10 as well, at our center with individuals that have high blood pressure. And the coenzyme Q10 is about 100 to 200 milligrams a day. All right, so the CoQ10 is 100 to 200 milligrams a day. Folic acid is around 5 to 10 milligrams a day. The guar gum is 7 to 10 grams with each meal. Yeah, that's a good size. So 7 to 10 grams of it with each meal. And then L-arginine is 4 to 24 grams a day. It's the range that the studies have been looking at it. So we'll usually use about 6 grams of it 3 times a day, and then if we need to up it, we will, and so on. So some of them can be a good-sized dose.
Are those gel caps?
You can get the veg caps, but the L-arginine, you can get it in a powder. So you can just use it in a powder and put it in water, mix it up, and take it. CoQ10, you can get the veg caps with it, and yeah.
Better than getting the blood.
Step 6, you want to use blood pressure reducing herbs. And there's 3 that have been studied and have good science behind them. That's hawthorn berry, hibiscus, and olive leaf. So not only can you eat the olives, but you can make herbal teas or whatever of the olive leaf and use that for helping with blood pressure. With the hawthorn berry, you're looking at anywhere between 160 to 1,800 milligrams every day, divided in 2 to 3 doses. All right. So 160 to 1,800 milligrams a day, divided into 2 to 3 doses. Those are the ranges that they show in the different studies. Hibiscus tea, you're looking at about 1.25 to 2 grams of the hibiscus boiled in water 2 to 3 times a day. All right, so that amount, 1.25 to 2 grams boiled in water 2 to 3 times a day. Or there's a hibiscus extract that you can get and then just take that as directed. And then olive leaf, there's an extract that was used in one study, and it was 400 milligrams a day of olive leaf extract. Step 7, get your exercise. Exercise has been shown to reduce high blood pressure, even though your blood pressure tends to increase while you're exercising. Right? So during the process of exercise, the blood pressure tends to increase, but the overall effect of exercise is to decrease the blood pressure. And it's been shown to be beneficial both to have cardiovascular exercise and resistance exercise in that process of blood pressure reduction. Number 8, avoid caffeine, alcohol, and tobacco. Right? All of those are things that increase the blood pressure. Tobacco is responsible for about 6 million deaths every year around the world. Alcohol is responsible for about 3.3 million deaths around the world, so that's almost 10 million deaths between the two. Caffeine, however, rarely causes death, but it's the most consumed addictive drug in the United States. About 85% of the US adult population is drinking it, and the average is about three cups of coffee is the equivalent average dose in the US population. So for every person like myself that doesn't drink any, there's somebody getting their extras to make up the average. Right? Step 9, lose weight. And that's very important. Remember, we talked about that hormone leptin that's produced, stimulates the brain, causes that fight or flight response, the sympathetic nervous system. Well, when you decrease the amount of fat that you have, and you don't carry as much around, but also you don't have as much of that leptin that's produced, and so it doesn't stimulate that hypothalamus, cause the sympathetic nervous system to be discharged. It decreases the amount of blood pressure. And so weight reduction is a significant help in regards to blood pressure management. Now, if you're already skinny and you have high blood pressure, well, you have one less thing that we can work with. To work with all the other stuff, we can't rely on the weight loss. But if you're big and you've got high blood pressure, we got a lot to work with. You're going to work on the weight loss, and usually that has a significant impact upon the blood pressure. Number 10, get good sunshine. Fresh air and sunshine, right? It can be remarkable how fast sunbathing can decrease your blood pressure. Right? And in fact, well, I won't go there. All right. So we've had individuals that have had fairly high blood pressures. Of course, sometimes individuals come to Uchee Pines because of that, right? And they want it to get reversed. Well, when you have a nice Alabama summer, and it's nice and warm out there and the sunshine is beating down, you can take somebody who has high blood pressure, you can take them outside, just lay them down on a chair in the sunshine and let them sunbathe for about 20 minutes. And you can see blood pressure reductions up to 40 points. So if they were 200 down to a 160 or so, just in 20 minutes, reducing the blood pressure just from sunbathing. So don't forget about sunshine when you're thinking about blood pressure reduction. It's a very efficient way of helping to decrease blood pressure.
And on majority of our blood pressure medicine, because we deal with a lot of people in farmers, they have on their big bold letters, no sunshine if you're on medication.
Right, so if you're on blood pressure medication, then there's warnings about getting sunshine exposure associated with it. And those warnings are not necessarily because they don't want you to pass out and so on, but the medications will, when you have sun exposure, sometimes the medications will interact with the sun exposure and will develop rashes and other complications associated with that sun exposure. So why take something that gets you away from the sunlight, which brings so much health and healing? I don't know. Yeah. So go out and get your sunshine regularly. Step number 11, get good sleep. Right? At our center, what we find is that, let's say, for instance, we're doing their blood pressures every morning and we're monitoring that, and let's say they're 135 over 80, 137 over 82, 130 over 78, and so on and so forth. And they're fluctuating around that range. And then one day, they're 150 over 90, right? So it's popped up a bit, maybe 10, 15 points higher than what it was before, what their baseline was. One of the first questions that I want to ask them is, how did you sleep last night? Oh, I had a horrible sleep and I couldn't get to sleep and this was going on and that was going on. All right, I know why your blood pressure is high. You didn't sleep well last night. So when individuals sleep well, we find the blood pressure is being better, and then when they don't sleep, it increases the blood pressure. And there's research that shows that sleep deprivation causes high blood pressure by changing how the brain responds to the blood pressure signals, increasing that blood pressure with poor sleep. Step number 12, breathe deep. Right? Deep breathing has an impact upon blood pressure as well. And there's a particular breathing technique that we use at UT Pines called 4-7-9 breathing. So I'm going to demonstrate that for you. All right? 4-7-9 breathing is where you breathe in for a count of 4, you hold your breath for a count of 7, and you breathe out slowly for a count of 9. Now we're all going to practice a few times, all right? So just again, we're going to breathe in for a count of 4 seconds. We'll hold it for a count of 7 seconds, and we'll breathe out for a count of 9 seconds. All right? So prepare, all right, and in. 2, 3. Hold. 3, 4, 5, 6, 7. Out slowly. 1, 2, 3, 4, 5, 6, 7, 8, 9. In. 1, 2, 3, 4. Hold. 2, 3, 4, 5, 6, 7. Out slow. 1, 2, 3, 4, 5, 6, 7, 8, 9. Breathe in. 1, 2, 4. Hold. 2, 2, 3, 4, 5, 6, 7. Out slowly. 1, 2, 3, 4, 5, 6, 7, 8, 9. All right, now you can breathe. All right. So that,
The pressure right down.
yeah,
You can take your blood pressure one time and then take it again. And it just
exactly. Right. Yeah, it brings your blood pressure.
White coat syndrome.
Uh-huh.
Because they come in and you've been like jet lagged and you got to go in there and do a pressure.
Yeah, that helps to bring that blood pressure down quite quickly. Yes.
How many times do you do in a row? 3?
Right. No, I'm just demonstrating for 3. What you want to do is you want to do it for about 10 times in a row, or maybe 15 times in a row. And I usually, with individuals that have high blood pressure, I usually advise them to do that every hour, right, throughout the day. It'll cause the blood pressure to come down, but the blood pressure coming down is temporary. So it comes down temporarily, and then it goes back up again. Right? But every time you can bring the blood pressure down, even temporarily, it decreases the overall impact on the blood vessels and the effect of the high blood pressure. So every dip you can get helps, right? I didn't say every dip that you are helps. Every dip you can get, right? And we're not.
10 to 15 times, and how many times a day?
Every hour.
Every hour.
Yeah. So just taking it takes a couple of minutes to do, 10 to 15 rounds, and just taking that break every hour, doing that deep breathing, and that can drop your blood pressure 5 to 20 points or so just within a couple minutes. All right, step number 13, you want to reduce your environmental noise. That means children should be seen and not heard, right? No. It's true about the environmental noise. There are studies that they're just rolling their eyes at Daddy. That's okay. There are studies that show that if you live on a home that's on a busy road, and you live in the room that's on the side of the house towards the busy road, your blood pressure is higher than those who live in the rooms on the back of the house, towards the backyard. right? So the greater environmental noise, then the more constant that noise, the more the fight or flight system that you have going on, the greater the blood pressure will be. So look at reducing that environmental noise. If you sleep in a noisy environment or you're there constantly, maybe think about getting earplugs, right? That might be helpful. Number 14, step 14, do hydrotherapy treatments. One of the ones that you can do is a hot foot bath. That one's pretty simple. And we'll be demonstrating that tomorrow as well. And a hot foot bath simply is a basin of water with hot water, or a bathtub and sitting on the edge with your feet down in the water, and having the water about as hot as you can stand it. If you don't have diabetes, you don't have blood clots in your leg, or circulatory problems in the legs. All right? If you have those, then there's things you've got to watch out for. But if you don't have those, then it can be as hot as you can tolerate it, or as comfortable. And just rest your feet in there. Maybe wrap up with a blanket or so. Leave your feet in there for about 20 minutes or 30 minutes. And that can bring your blood pressure down. Why? Well, you only have a certain amount of blood in your blood vessels. And if you apply heat, the blood vessels dilate. If you dilate the blood vessels, that means you have more space for the blood, and there's less pressure on the blood, so the blood pressure goes down, right, overall. Or you can just take a warm bath. Just get in a warm bath, not a really hot one, but a warm bath, and just soak in there for about 20, 30 minutes. That can cause your blood pressure to decrease, again, because your blood vessels dilate. And when they dilate, there's less pressure that's been put on the blood inside those blood vessels. And step number 15, eliminate your stress. Right. Eliminate your stress. That psychosocial stress can be tied to difficult relationships, financial trouble, negative experiences in the past, tied to negative thinking, loneliness, bitterness, guilt, right, and so on. All of these have been shown to increase blood pressure. You might not think about it, but loneliness, yeah, there's a number of studies showing that loneliness increases blood pressure. And so these psychosocial factors can definitely increase the blood pressure. And what's going to help that? Well, there's a Savior that you can come to. There's a God who loves you, and you can put your troubles and so on and so forth in His hands and let Him take care of it. You don't have to worry about it and so on and so forth. You can trust in Him. He loves you. He'll care about it. And you don't have to get all stressed out yourself about it. Right? Trust in God, that last banner down on the end, very important. Right? And that can help out quite a bit with the stress. Now, one of the things that I didn't mention before, when we were talking earlier today, and I'm going to interject it now because it's a really important point, and it relates to stress, right? And that's this. If I get this bottle, and it's sitting up here on the podium, and I knock it over, and it falls on the ground, and water comes spilling all out over the ground. Why is it that water came spilling out all over the ground? Okay, well, the lid was open. It got knocked over, right? Well, if I knocked it over and juice came spilling out all over the ground, why is it that juice came spilling out all over the ground? Because that's what was in it, right? If I knock it over and marbles come out all over the floor, why is it that marbles came out all over the floor? Because that's what was inside, right? So naturally, what comes out of something because it was in the something, right? Now, from a psychosocial standpoint, a relationship standpoint, a personal and an interpersonal standpoint, whatever happens to you, it doesn't matter what it is that happens to you, how you respond has nothing to do with what happened to you. It has everything to do with what's inside you, right? Because it couldn't come out if it weren't in there. That's right. And the Bible puts it this way. Jesus says, out of the abundance of the heart, the mouth speaks, right? And Solomon, the wise man, he put it this way. He says, out of the heart flow the issues of life, right? So out of the abundance of the heart, the mouth speaks. If it's in there, it can come out. If it's not in there, it can't come out. So if somebody goes to you, and you go back to them, your to them is not because they went to you, it's because lives in your heart. And their attack or whatever it was only the tipping of the bottle, right? But what came out when the bottle was tipped had nothing to do with them. It has to do with what's inside, right? So recognize that however you respond to whatever the situation is, your response is about you, not about them. And it reveals to you what's in your own heart. Right? Now, how does that help me with stress? Well, it helps you with stress because the opposite is also true. And that is, whatever somebody says or does to you, it's not about you. It's about them. Because it couldn't come out of them if it were not in them. That's right. It's a revelation of their heart. And so even if they direct it at you, and they direct it at you purposefully and repetitively, it's still not about you. It's about them. It's their problem. And it's their heart issue. Right? And when we recognize that, we don't have to get so caught up in the things and go, oh, I can't believe they did that to me and they said that about me and all of that kind of stuff. Our response would not be so much that. Our response would be, oh, well, I feel sorry for them. What's going on inside? I mean, all of this is coming out. It's got to be like horrible in there. Yeah.
I just have to say this because, you know, we do a lot of teaching, my husband and I, and people hit you with everything. From students to the adults when you go to their farms and they, oh, you wouldn't believe what they did. I said, honey, look, it's not what they did, what they said. How did you react? I said, just look at them real strange and say, oh my God, I need to pray for you. Say, honey, you must be having a rough week. Hey, maybe a rough month, my God. I said, just say, you know, you're in a spiritual warfare. I mean, it's not you who they are fighting. It's, you know, we war against not flesh and blood, but, you know, spirit.
Mm-hmm.
So I'm like, you know, don't take it so personal. I said, I know it look personal, but look at them and say, honey, I'm just so sorry you're having a bad time. Let me pray. I said, right there, the fence go down. They feel bad that they want to curse you out or treat you that way, and you resolve the situation.
Yep.
It works every time.
Yep.
So that's real.
Yeah, absolutely.
It works.
So in summary, yeah, absolutely. In summary, for high blood pressure, what you can do naturally at home to help out is 1, fast. Number 2, eat a low-salt diet. Number 3, maintain a high potassium to sodium ratio in your diet. We talked about a number of foods that would do that. Number 4, include blood pressure reducing foods in your diet. Number 5, include blood pressure reducing supplements, right, like the CoQ10 and so on, and the L-arginine. Use blood pressure reducing herbs like the hawthorn and hibiscus and olive leaf. And number 7, exercise regularly, both resistance and cardiovascular. Number 8, avoid caffeine, alcohol, and tobacco, those things that increase the blood pressure. And I didn't even mention the hard drugs, but those as well, cocaine and amphetamines. Number 9, lose weight. Number 10, get your good sunshine. Number 11, get your good sleep. Number 12, breathe deep, your 4-7-9 breathing. Right, regularly, every hour or so. Number 13, reduce that environmental noise. Number 14, do your hydrotherapy treatments like hot foot bath and a warm bath. Number 15, eliminate your stress. Right, remember, it's their problem, not yours. And then you can be nice and happy. Happy like a little baby. Right? And then so you can help in the process of reversing your high blood pressure naturally.